Hello, everyone, and welcome to our HealthLinks Community of Practice webinar. My name is Sandy Seaman, and I have the pleasure of introducing our webinar today. We're going to start off with a few words from Lee Fairclough, our Vice President to Quality Improvement here at Health Quality Ontario.
Hi, everyone. It's Lee Fairclough. For those of you that joined the webcast on last month, you will have seen me on there, and you will have heard about the work that HPO hopes to support in the field for the HealthLinks as we go forward. What we're going to do today is really talk a little bit about the best practices work and the identification of innovations to support you in the work that you're doing. But this will just be one of a series of webinars that we will be offering, and we really look forward to our ongoing engagement with you. And with that, I'll turn it over to Sandy and the team.
Thanks, Lee. We're calling this a community of practice. Why? Because we are a group of people who share a common concern about HealthLinks patients, and because we believe that we can learn from one another how to better care for these Ontarians if we interact regularly. We thought about having a community of practice specific to care coordination, but we decided that it made more sense for us to come together as people with a passion for HealthLinks and to introduce topics that we as a community believe to be critical to the success of this integrated care delivery model. We'll speak about the community of practice again later in the webinar, and we welcome your thoughts about how we can move forward together as a community of practice. Our priority topic has been coordinated care planning. It makes sense that we focus on this because our HealthLinks patients tell us that there are pockets of care and service excellence in every sector, be it acute care, long-term care, primary, or community care. But the real challenges and failures occur in the transitions and in the lack of alignment between providers and between sectors. We haven't communicated well with one another, and we failed to coordinate the care around the patient's priorities. So why don't we get started? I want everyone to know that we're recording this webinar. It will be accessible on the Health Quality Ontario website under the HealthLinks section. The slide deck will be available in both French and English. To ensure good sound quality, all participants have automatically been placed on mute. However, we do want to hear from you. We want you to take advantage of this time by asking questions and seeking clarification where needed. In order to do this, please open your control panel by clicking the orange arrow to the right of your screen. From there, you can post your questions into the chat box feature. We will pause throughout the webinar to answer your questions and respond to your comments. You may also find responses to your questions within that chat box. If we're unable to answer your question during this webinar, we will respond via email. So who are you going to hear from today? Well, we've heard from Lee Fairclough, our Vice President, Quality Improvement. You've heard from me, Sandy Seaman. We'll also hear from Stacey Barzeev, our Team Lead for our Best Practices Network, James Mayer, our Project Coordinator, Jennifer Wright, Gina D'Souza, and Lori Hurley, Quality Improvement Specialist. Today, we'll address the Best Practices Framework, the Innovative Practices Evaluation Framework, the link between data and spread at scale of leading and best practices, and finally, capturing from you priorities about where we should focus our best practice efforts. So let's hear from you. On your screen, you can see some options where you can select areas that are a focus for you in your HealthLink. Please select up to 3 areas where you are placing your priorities. I'll give about 10 more seconds for responses. James?
I just launched it now, sorry.
Oh, sorry, we've just launched it. My apologies. We'll give you 15 seconds to comment. My apologies.
Welcome to the webinar. You have entered as an attendee in listen-only mode.
James, do we have responses?
Do you want to give about maybe 10 more seconds?
10 more seconds? All right, 10 more seconds.
Okay. So the top one is engagement. This is building teams and physicians and patient engagement, followed by transitions and care, and then mental health and addiction.
Excellent. That's really interesting. I'm pleased to hear that, and I think it aligns well with what we're hoping to do going forward. So thank you, everyone, for participating. We will use that information going forward in our planning. As this webinar unfolds, we will support, we'll be providing you with information about how we'll be supporting the identification of best practices and innovative practices worthy of large-scale spread. H2O will also support LINs and health links in the timely analysis of data and help us all to understand what story the data are telling. Some of our colleagues call this report and support. Through that lens of quality improvement, performance and innovation are understood as interdependent forces that fuel the advancement of health links. I'd like to now pass you over to Jennifer Raitt, our Quality Improvement Specialist for Central and Eastern Ontario. She's going to talk to you about how data can be used to accelerate the implementation and spread of innovative practices. Jennifer?
Thank you, Sandy. I am joining from offsite. I do want to make sure you're able to hear me. Are you able to hear me?
We can hear you.
Wonderful. Thank you. So as Sandy mentioned, Health Quality Ontario is supporting the centralized data collection for health links. This is primarily being done via a centralized digital platform called QI-RAP, which stands for the Quality Improvement Reporting and Analysis Platform. This platform was rolled out provincially in late April. This is where health links are reporting their indicator data regarding care plans and physician access within the health link. Briefly, QI-RAP has the functionality to collect and display data at a health link, LIN, and provincial level. The centralized data collection site has increased the shareability and the utility of this data, as other health links, LINs, and provincial stakeholders can view the data entered across the province. Of note, there are user guides and recorded webinars available if you'd like to learn more about QI-RAP. Here at H2O, we're quite interested in utilizing the full capacity of the QI-RAP platform, and in particular, this group has been looking at how to use this data to, in conjunction with additional resources that can be leveraged to identify and extract innovative practices for the benefit of the province. Next slide, please. Slide 7. Let's take a deeper dive specifically into the relationship between data and innovative practices. So looking further at QI-RAP, health links currently submit their quarterly indicator data through this platform. We at H2O can then, and as well as the health link and then partners, can review this data to mine for opportunities for improvement and to identify where we could dig further for the best and or innovative practices that are being used in those areas. Essentially, using QI-RAP in this way serves as an additional source for the systematic identification of innovative practice. That is, in addition to how we have already been collecting this information via speaking with our health links directly, attending conferences, word of mouth, etc. Once H2O has mined and collected these innovations, we can evaluate them further and then share or make recommendations about innovative practices importantly, what hasn't worked well. And that's for the benefit of other health links and, of course, the patients within those health links. Next slide, please. So here we see a report produced within the QI-RAP platform. And what we're looking at here is a graph depicting the data that was entered by the health links in the Toronto Central LIN region, specifically on the number of coordinated care plans produced by quarter. So let's, for example, look at Midwest Toronto Health Link, which is shown using the light gray line. In looking at what happens following the July to September 2014 reporting period, we can see a steady increase in the number of CCPs being reported within that health link. So this finding may prompt us to connect with this health link to explore what change ideas may have led to that increase. And in doing so, we can then evaluate that practice and facilitate the sharing of knowledge in a variety of ways and support the uptake of those practices in the area. Next slide, please. Just introduce you to the process of collecting, evaluating, and disseminating innovative practices. On this slide, I'm going to draw your attention to bullets 2 and 3, which provides you with a bit more detail on some of the ways Health Quality Ontario can support the dissemination of best practices. Bullet point 2 refers to the practice-based guidance documents and support, such as the Coordinated Care Planning Guidance Document that's currently in progress, that pull together rigorously reviewed information from the literature and the lessons learned from around the province. Bullet point number 3 refers to Health Quality Ontario's work to continue the development of communities of practice that pull together groups of people who share an interest, passion, or concern, and they can interact and share via webinars such as this one, via virtual collaboration platforms, or by other means. Stacey is going to further elaborate on the evaluation and dissemination elements in just a few moments. Next slide, please. Here is the visual model that pulls the elements together that I've just touched upon and includes some of the remaining elements. This is the Health Quality Ontario Innovative Practice Framework end-to-end. We are identifying topics, and as I just mentioned, we look towards the literature and pull innovative practices from a variety of sources in step 2 and 3. Step 4 elaborates further on how we evaluate innovative practices to look at the quality of evidence, impact, applicability, and transferability. Then we will be bringing those recommended innovative practices to a clinical reference group for further evaluation. Stacey's going to elaborate more on the evaluative piece and the clinical reference group in the next section. Once the clinical reference group endorses a recommendation, we move forward to the knowledge translation and implementation components. And then, of course, we're looking at measurement indicators to inform our process as we go. I'm now going to pass you over to Stacey, who will share more about how the innovative practices will be evaluated and disseminated.
Thank you, Jennifer. Before we go ahead, we just wanted to pause and see if there were any questions in the chat box that we could address. James?
No.
Okay, great. Then we'll keep going. Please do feel free to ask questions, and we will be happy to answer them at the end of the webinar. So now I'd like to share with you the Innovation Practice Evaluation tool that we are now testing to evaluate the innovative practices that we have collected. This tool was adapted from the Health Council of Canada's Innovative Practices Evaluation Framework, which was developed to support efforts to report on innovative practices that demonstrate a positive impact on health outcomes and/or health system performance to allow a consistent and standardized approach to categorizing innovative practices in order to spread them. This categorization captures the different stages a practice may be in at the time of its evaluation with the tool and categorizes the innovative practices at 3 levels with increasing degree of belief: emerging practices, promising practices, and leading practices, with the goal of ultimately identifying practices for wide-scale recommendation for implementation. Practices are weighted against the following dimensions: quality of evidence, with leading practices being backed by rigorous or high-quality evaluation methods; positive impact on project-specific measures, outcomes, or performance; applicability, or being sustained over time; and the fourth one, transferability, that is, being replicated in other settings. In addition to recommending practices for wide-scale spread, we will be working to connect health links to share and spread emerging and promising practices and key lessons learned from those practices that were ineffective or failed to contribute to effective health outcomes
or healthcare performance in order to increase the rate of progress and standardization across HealthLinks. Using this systematic approach, we believe that HealthLinks can rely on the best data to inform decision-making on which practices to test and implement to support the work in this area. Next. To provide an example of how the innovative practice evaluation tool is applied, we'll use an example from the coordinated care planning process innovations that were collected and evaluated. In the coordinated care planning process, once the patient is identified and invited to participate, the initial interview should be conducted. The initial interview is foundational to the care planning process, and patients should play an active role. In conducting the interview itself, using a validated motivational-based interview technique to garner the information needed to develop the care plan was identified as an emerging innovative practice. Specifically, to provide some background, as an example, the Timmins HealthLink recognized the need for care coordinators to go into the patient's home trained in interviewing and observation, with an emphasis on the social determinants of health. Using sensitively asked questions with the Discovery Interview Guide, they were able to identify a solution in approximately 30% of cases that did not require utilization of a health-related service, rather required services that specifically addressed social determinants of health, such as housing, social services, or public safety. Using the Innovative Practices tool with the practice across each of these dimensions, looking at the quality of evidence, the data collected at this point was internally and observationally, so it was allocated 1 point. On the impact dimension, the practice was revealed to have a positive impact on project-specific measures in 30% of cases, so it got 1 point. In terms of applicability, practices were successfully implemented and sustained, and again, it was allocated 1 point based on the scale. And transferability, these results could theoretically be replicated in other settings, for a sum of 4 points, which blends to its classification at this point in time as an emerging practice. Next slide. Following the evaluation and compilation of recommended practices for spread, we plan to share these with the clinical reference group, which is currently being put together for endorsement and validation of these practices for wide-scale spread. In order to disseminate these practices, we plan to launch a guidance document for specifically for care coordination as the initial one, as well as additional support such as a checklist and other tools and resources. An inventory of HealthLinks innovations, plans for continuous learning and engagement, one-stop access for tools and resources, as well as a webinar series, which I'll talk about in a moment. Our current focus is on coordinated care planning. We have heard from you a readiness for information, and we are keen to provide this information to the HealthLinks. We are currently in the process of embedding the evaluated practices that were collected and evaluated by this tool into guidance documents, which will include a standard definition of coordinated care plans, recommended steps to conducting coordinated care planning, including identifying the patient, inviting the patient, the initial interview, the care conference, and maintenance of the plan and transitions when things change. We are identifying recommended practices that will be highlighted in the documents, along with key lessons learned, as well as sharing of ineffective practices that were identified, as well as tools and resources. This information will go to the clinical reference panel and then will be disseminated to you. We are planning to connect the HealthLinks community and will be hosting a series of webinars that will allow us to take you through a more detailed dive into the innovative practices that we evaluated, with an opportunity to hear from the high performers and share lessons learned. These webinars will provide a forum for learning, sharing, and spreading of best practices. This slide provides you with the dates of the upcoming webinar series. We also have a couple of face-to-face get-togethers, such as Health Quality Transformation, which will bring us together on October 14th. We will be sharing this slide deck afterwards, so you will have a copy of these dates. Next slide. On October 14th, we will be hosting our annual Health Quality Transformation Conference. We have put out a call for abstracts, and I wanted to highlight that this year we have a specific category for submissions on health links and are looking for abstract submissions from you on work demonstrating advances and innovations in the provision of improved and more efficient care for patients with complex care conditions or multiple comorbidities, as well as those that address the role of the LINs and interlink exchange. We will be hosting a lunch and learn session highlighting some of these select abstracts during the day, so we urge you to submit an abstract. If you do require support or assistance with this process, please don't hesitate to reach out to us for support. The deadline for submission is July 30th, and you can get more information about the call for abstracts at www.hqtabstracts.ca. I also wanted to highlight that our quality improvement specialists are available to all regions with expert QI knowledge and previous experience with early adopter health links and provincial perspectives to share. And outreach with the LINs is currently underway. Next, please. I also wanted to take this opportunity to remind you of 2 upcoming QI-RAP webinar dates, on July 15th for LIN Senior Directors and July 16th for Health Links teams. These webinars will demonstrate the 5 new reports that will be available to users on QI-RAP. If you have not received the communication related to registering for these, please do email us at hlhelp@hqontario.ca. Now, we do want to take a few moments to ask questions to you and open up for dialogue. We would love to hear from you on how we can best support you. How can we best connect you? Do you have any success stories or learnings that you could share with us? Please take a moment and enter into the comments or in the chat box, or email us after the webinar at hlhelp@hqontario.ca.
Thanks, Stacey. James, do we have any questions or comments in the chat box?
Nothing just yet. We can wait a few more, about 10 seconds, to see if anyone has a question.
Sure, we'll give people a chance. We just gave them a lot of information over the last 20 minutes. Thanks, Stacey. We're quite excited about the plans going forward with innovations and best practices. Evaluating innovations has been quite a challenge, and we were really pleased to be able to have access to the Health Council of Canada's Innovative Practices Evaluation Framework. And I think we've done a nice job here of modifying it to take into consideration quality improvement approaches to innovations as opposed to some of the stricter, more research-oriented approaches to evaluation of practices. So I think it's going to be an interesting journey, and we really welcome your feedback. I hope that most of you received a copy of the Innovations Evaluation Framework yesterday in the mail. It was hard to see it on the screen, I know, so we were hoping that you would have hard copies with you as you were listening to Stacey's presentation. James, it looks like we've got a little activity.
Yeah, we're just trying to read it. Hang on just a second.
Yep, so we do have one question. The first question is, should we apply the innovation evaluation tool to all of our initiatives?
That's a really good question. Since we're testing the tool right now, I think it would make some sense for you to do this testing with your quality improvement specialist with you. I don't think there's any need for you to do that kind of evaluation at the health link level or at the LIN level. We're pleased to do that at Health Quality Ontario, bringing together a diverse group to do that evaluation. I think it's good for you to keep it in mind, though. I think you should be referring to it in terms of better understanding those innovations that you have been identifying as part of your Health Links work. If you do decide that you want to do a bit of testing of that framework with your QI specialist, we'd really appreciate hearing from you about how it's worked, where it gave you challenges, where you had difficulty, where you found it helpful. We're very interested in better understanding how we can apply this framework in our real world of quality improvement.
We have some more questions. There's someone who wants more clarification regarding how the CCP Guidance Document Innovative Practices have been gathered and is the process still underway?
That's another good question. These are great questions. Thanks, James. We've taken a number of routes to gathering these innovative practices. Some of you were probably on our very first Communities of Practice webinars back in February, where we talked about coordinated care planning, some of the challenges, some of the barriers, some innovative approaches, things that just didn't work. So we captured a fair bit of information during that Community of Practice meeting, and we also had people submit information following those webinars, and we've collected all of that. In addition, the quality improvement specialists interviewed leaders in all of the early adopter health links. They gathered a lot of information, more than just about coordinated care planning. They gathered information about everything from operations through to patient experience. And we're cataloging all of those innovations and looking to make that available to you in a format that's useful. In addition, we also scoured the literature. We went to the Ideas Program's Ideas Share website, where a number of Ideas participants have worked on health links, and in particular, care coordination. We've looked at the quality improvement plans that have been submitted from across the province, from all sectors, and we have been able to harvest wonderful innovations from those reports. I would be remiss if I didn't also mention the health quality transformation abstracts from last year's health quality transformation. We certainly went through all of those to identify innovations. And I'm sure there are more, but I think we've done a pretty broad scan of sources of information around innovative practices related to health links. The final part of that question was, are we still looking for information? You bet. This work doesn't have a finish line. As we improve in quality improvement, we're always looking for a better way, something that really makes things better for the patient, provides better outcomes, makes better use of our resources, and really improves the quality of the work life for care providers. So we're always looking for things that are improving. So please feel free to send notes through to hlhelp@h2ontario.ca, or through your quality improvement specialist, or to any one of us that have been on this call. All doors are open, and we're interested in all innovative practices that you're feeling really proud of and want to share.
We do have another question. Someone wants to know who would be invited to the webinars on the different processes, and are the partners also going to be invited to it?
The webinars that are coming up for the quality improvement, the coordinated care plans, we'll send those invitations out to the LINs, and we ask that the LINs and the health links invite anyone that they think should be at those webinars. The more the merrier. I think there should be no restrictions on this. If you have patients that want to listen to these webinars, go for it. Invite them to be a participant, and I'd encourage you after the webinars to have a roundtable discussion at your sites. What made sense? Does this make sense for us? Do we have things that we should be putting forward? I would really encourage you to see these webinars as a catalyst for further dialogue within your areas. And that's it for questions. Wow. I'll wait for another 10-15 seconds to see if there's anything more. Any other comments from people on the panel? No? All quiet in the chat box? Well, I'd like to thank everyone for participating. We're really excited about moving forward and providing support to you. We see this as a partnership, and it's a wonderful opportunity for us to improve the care of Ontarians with complex chronic illness. So I look forward to meeting all of you again next week in the webinars for the QI wrap and early in August for the webinars around the care coordination. Thank you all for participating.